Welcome to Stethoscopes and Student Standpoints, the official podcast of the Alberta Medical Association, AMA, Medical Students Advocacy Committee, and the first ever inter-school podcast led by medical students in Alberta. My name is Sana.
And I'm Abdullahi.
Today we're diving into a topic that really exploded during the pandemic and isn't really going anywhere: virtual medicine. And whether you call it telehealth, video visits, or digital care, it's reshaping how care is delivered across Alberta.
Yep, and we'll explore how it's being used in different parts of the province and how it's changing patient expectations, what it means for rural access and continuity of care, and what we as medical students need to be learning.
Yeah, let's dive right into the state of virtual care in Alberta and start where we are. So in 2020, of course, we all lived through the pandemic. There was this massive surge in virtual visits, and a lot of visits have actually continued to be virtual, and it has really massively promoted that delivery of healthcare more so than pre-pandemic times.
Yeah, and the number of patients continuing with this telehealth care is really high in some specialties. So for instance, for psychiatry, for diabetes management, and routine follow-ups, many providers have stayed virtual because it reduces no-shows, saves travel time, and improves flexibility for both the patients and physicians. And most importantly, it makes care more accessible.
And this isn't just something unique to Alberta. We see it in Ontario, where virtual visits, and in BC, virtual visits and telehealth billing codes were made permanent to encourage it in its long-term use. And there were virtual billing codes introduced during COVID, which continue today.
Yep. Virtual care is also central to discussions about modernizing primary care, especially in underserved or rural communities. For patients in places like Peace River, Fort McMurray, or Lethbridge, virtual consults with specialists or family doctors mean less travel time, faster access, and in many cases, safer care.
Yeah, and this is, of course, true of virtual visits that are possible. Of course, we should know the limitations where you can't do physical examinations over virtually or do that part. But for taking patient histories, it can be great. And that's where virtual care shines. So let's talk about a couple more other effective applications of where virtual care does work. So there's been a great surge in terms of mental health care, in terms of therapy, psychiatrists, medication checks. Again, that idea of taking histories, or chronic health disease follow-ups for patients that don't have too many changes, medication renewals as well, and dermatology, where patients can send photos. That has been useful in terms of primary care setting dermatology, and even diabetes and hypertension reviews like we mentioned before. And especially after COVID, a lot of people got their own temperature thermometers, they got their own blood pressure cuffs, especially during that time. So they can even provide some data for physicians. Of course, it's not as reliable, but just something that can be used in conjunction.
Yeah, but there are also limits. So if a patient has shortness of breath or chest pain or needs a physical exam, unfortunately, virtual care isn't going to cut it, right? And even for some pediatric visits, prenatal care, or anything involving abdominal exams, it's really hard to do that safely over the video, right? If a patient's having an MI, virtual care might not be much use to them.
Yeah, exactly. And patient experience is also an important factor to consider here. I know some people, just including myself, love the convenience. People are busy, they have work, they have kids. But we need to understand that this isn't necessarily beneficial for all folks, such as people with digital illiteracy issues, or people who are not quite familiar with using and safely using the digital space. There might be some struggle there. So there was a study in Alberta that showed that patients that were lower income and older adults were less likely to use and benefit from virtual care. That could be in difficulties in, of course, using it, then the platforms, not being taught on the safety of it and how, but further things like that.
Yeah, and language barriers also add another layer. In-person visits often allow for nonverbal cues and easier interpreter access or cultural understanding. And these are things that can be lost or even rushed or feel impersonal during a virtual visit.
Exactly. I know that I was speaking to a couple patients, and there was a patient who was talking about their cancer diagnoses during COVID, and it was actually done over the phone. And I remember being really shocked at that. Of course, it was needed at the time, and it was the surge and peak of COVID, and I'm sure no one wanted it to be done that way, and it simply had to because it was hard times. But it really made me think about that patient care and how important it is that certain things really do be delivered in person when they can. So that, of course, was an emergency situation, but that's something that we need to consider. And let's talk about the impact of the continuity of care.
Yeah, one concern that keeps coming up is fragmentation. So patients without a regular family doctor may turn to virtual walk-in platforms. While that solves an immediate need, it can lead to gaps in care, labs not being followed up, med interactions being missed, or chronic diseases slipping through the cracks.
Yeah, and continuity of care is really important. That's the whole idea that family or primary care practice is based on. There's a reason why we want people to have a regular family physician, because it's simply impossible for physicians to review the notes and the visits of every single other encounter a certain patient has had and memorize their medication list and know all that and go into their visits with this holistic idea of their health every single time a different doctor. The nice thing about primary care is that doctors have some familiarity with their patients, and they know generally how their health is, and they know the notes that they've written, and it allows for this continuity that has probably shown better outcomes for that patient as opposed to having this fragmented care.
Yeah, and this is where system design matters. Integrated EMRs, shared patient records, and communication between providers can be helpful. But it also depends on how we train new doctors to think about care continuity, even when they're behind a screen.
Exactly. So I think the next really important part of talking about AI is how can students get involved? So if you're a medical student listening, here's 5 ways to get involved right now. Number 1, advocate for curriculum reform. Ask faculty to include virtual visit skills in small groups or OSCEs. I think that's a very important one, in that it can be a bit different dealing with people and the systems that we use online. So it'd be good to get some training in that. And I know some of that is already in the works. And yeah.
And I think another important thing is shadowing virtually whenever you get the chance to, especially in family medicine, psych, or in endocrinology. I had the chance of sitting in on a couple of virtual telehealth calls when I was shadowing family medicine. And, to my surprise, it was very insightful and comprehensive, with the ability to take a history and have that conversation as well. And a lot of the times when the patient is taking that call from their home or from that comfort zone, I think it just opens up the conversation a lot more as well.
Yeah, it's definitely a two-sided coin where potentially it can be less personal, delivering hard diagnoses when they're not in person, have that human touch. But at the other hand, you have people that are not in a doctor's office, which some may feel uncomfortable, and they may feel more comfortable in their homes getting news delivered. So it definitely is very patient specific, and it needs to be catered to the individual. So what are some other things that we can do here is support patients as well to struggle with tech, and teaching them how to access their results and preparing for virtual visits. This is really important at the medical student level. We, of course, have more time than the physicians that we're working under, and we can provide some education to patients who may not know of, for example, accessing their results online, which is now available in Alberta, which can be very nice. Of course, it needs to be done in the context of going to your physician and having that interpretation, and not just doing it all on your own and encouraging that, but making sure there's adequate virtual literacy is very important.
Yeah. And I think the fifth and the final thing we could do is really contributing to innovation within this space. I think there's a lot of opportunity for students to really be the leaders in promoting innovation here through building, like Sana mentioned, patient education handouts, partnering with digital health startups, or even consulting hybrid care models in Alberta. And I guess as medical students, and especially pre-clerks, we're in this like awkward position where we're not really like integrated into the healthcare system that well, and we can still see things really well from the perspective of the patient. We're not, I guess, we haven't gone through clerkship yet, and so we're kind of in the middle between layperson and healthcare worker. And I feel like that perspective that we can bring to both sides of the table will be really valuable.
Exactly. And let's remember, lastly, that equity matters. So this advocacy isn't just about the new tech, but it's making sure that digital care doesn't leave people behind. So it means pushing for access in rural areas, having privacy-safe platforms, and making sure that they're vetted, because there is very sensitive information that's being shared. And of course, support for low-income patients or people that might have difficulties in having a private space and a computer to access during these virtual visits.
Yep, most definitely. And I think another important discussion to have, and we touched on this in our AI episode as well, is just having the infrastructure to facilitate the implementation of this kind of technology, right? And just on a practical level, is there that infrastructure for broadband communication, in a rural or remote community, right? That's really far up north. Can it support, everyone using the broadband, everyone accessing their care through virtually, right? And I think another important consideration to have is, environmentally, what impact is this going to have down the line? And can this, be a sustainable form of care going forward? And so I think those are important conversations to have going forward, and things to think about really when we think about innovation within this space, right? Sustainability and infrastructure.
Yeah, I love that. That's a great point. So as students, we can help shape this shift, learn all the skills, ask all the questions, bring patient voices into discussion, help talk to the patient and work them through this, and advocate for training that reflects this new world almost that we're entering.
And so if you like this episode, follow us on Instagram and visit amamedicalstudents.ca for more advocacy resources and student-led initiatives on digital health and beyond.
Thank you so much for joining us today for this discussion on telehealth. See you next time. Bye.